RNO is the professional association for nurses in Ontario and promotes excellence in nursing practice and advancing nurses' contribution to the healthcare system. RNO has a signature program called the International Affairs and Best Practice Guidelines Center that develops, disseminates, implements, and evaluates clinical and healthy workplace environment best practice guidelines. One of our best practice guidelines is on the topic of smoking cessation, and as part of our Tobacco and Nicotine Intervention Initiative, we hold regular webinars to support building capacity amongst nurses and other healthcare providers to implement and sustain tobacco cessation best practices. We want webinars to be interactive and engaging. We encourage you to type in a question or comment in the chat box during the presentation. For the last 15 minutes, our presenters will address these questions. In the event that we run out of time, our presenters have agreed to respond to your questions in writing. We will also be archiving these slides on our tobacco-free rnao.ca website so that they will be available for future viewing. Today are Dr. Leah Minaker and Dr. Bruce Baskerville from Propel Center for Population Health Impact. Dr. Leah Minaker is a scientist at the Propel Center for Population Health Impact. Leah's primary research area is tobacco control. Her research to date has provided timely evidence on key issues to the tobacco control community, including examining flavored tobacco use, hookah use, and other types of tobacco use among Canadian youth. The objectives of her research are to facilitate the development of programs and policies. Dr. Bruce Baskerville is Senior Scientist at the Propel Center for Population Health Impact at the University of Waterloo as well. Bruce currently specializes in tobacco control with a research focus on population-based tobacco cessation interventions, including the development, implementation, and evaluation of new tobacco cessation interventions or innovations to existing interventions. This includes work to produce an evidence-informed and trademark smoking cessation smartphone application called Crush the Crave. The focus of today's webinar is hookah use in Canadian youth. All laws in most places prohibit hookah smoking of tobacco. Most jurisdictions do not prohibit non-tobacco hookah smoking. Increasingly, Canadian municipalities and even some provinces are beginning to ban all hookah smoking in public places. Current smokers are more likely to use hookah than non-smokers, raising concerns about hookah use hindering quit attempts. Today's webinar will describe the problem of tobacco for young adults, describe development of Crush the Crave for smoking cessation, and share preliminary findings from a recent randomized controlled trial that Propel has completed. Now let me go ahead and turn it over to Leah and Bruce to start the presentation. Leah and Bruce, take it away.
Thanks, Jennifer. I hope everybody can hear me. Yeah, so I have done some research looking at hookah use among Canadian youth. So we'll go ahead and start my presentation. For those of you who are not familiar with hookah, hookah is also known as water pipe. And so the picture here of a water pipe or a hookah. It's an alternative tobacco product or an alternate tobacco product that's getting more popular and globally, not just in Canada or Ontario. Hookah is not always covered by national surveillance efforts, so many countries will have surveys on smoking use and adult smoking cigarettes, but not always do they cover things like water pipe use or hookah use, which some researchers have argued is a huge gap because as alternate tobacco products become increasingly popular, especially as cigarettes are more heavily restricted and legislated, some of the alternative tobacco products fall through the cracks, and so that's part of why they're becoming more popular. There is existing evidence that suggests rapid growth among youth and young adults in particular, because a lot of people perceive that smoke is not as harmful as cigarette smoking. So part of the reason for this is that as the tobacco smoke, there's a sort of charcoal in the bottom of this, heats up the tobacco leaves or the shisha. There's kinds of shisha that you can buy that's the tobacco or herbal matter that is burned with the charcoal at the bottom, but the smoke, before it passes to the through the tube, cooled down by going through the water. That sort of bubbles up through the water, cools it down, makes the smoke far less irritating for the hookah smokers. So that's part of the reason that people perceive that hookah smoking is less harmful, because they believe that the water actually filters out the harmful particles from smoke, even though that's not true, and the smoke from a hookah is just as harmful as smoke from cigarettes. Other part around the misperception is that, there's in this segment, because there's a lot of really fun flavors that are added to shisha nowadays. So I'll show you some pictures later, but one of my favorite ones is called Scooby Snack. And we all know Scooby-Doo is a child's, like a cartoon. So there's, and apparently Scooby Snack I think tastes like bubble gum or something like that. So there's lots of really appealing children flavors that are, you can now buy at shisha and smoke it using a hookah. That I answered recently with a research paper that I wrote, what is the prevalence of youth hookah use in Canada? What traffic factors are significantly associated with use? How are associated with use? Is the price of use changing over time? So methods. Propel administers the youth smoking survey, which is now called the Canadian Students Tobacco, Alcohol, and Drug Use Survey, or CADS, but it's called the Youth Smoking Survey for a long time. It's a provincially generalizable national sample of grades 9 to 12 students across Canada. So it's a little bit before the young adult years, but it's youth up to grade 12. Really generalizable just means that when we create estimates of, for example, Ontario youth smoking rates, that we are confident that our rates are in the reality because of the way that we sample. So 3,000 Canadian youth who participate in this survey every 2 years. Outcomes of interest that I was interested in looking at with this particular research was ever use of hookah, last 30-day use or current use of hookah, and how kids perceived the harm associated with hookah use. So the covariates that we tested, or the different kinds of factors that we thought would be associated with these outcomes of interest, were like sex, grade, province of residence, race, ethnicity, smoking status, and weekly spending money. So then we did some descriptive statistics to talk about the sort of prevalence among the population of these different outcomes, and logistic regressions were used to examine the covariates that were associated with ever or current use, misperceptions, and the change over time. In terms of overall prevalence, that 14.3% of high school students in Canada had reported ever using hookah. 5.4% of them reported currently using hookah, or this is the question that asked, in the last 30 days, have you used hookah or water pipe? 5% of them, so 1 in 20 Canadian high school students said yes, that I have used it in the last 30 days. The use among kids who reported using hookah was over half, so 51.4% of youth said that they had flavored varieties of shisha, which is the type of, like I said, tobacco or herbal match smoke using a water pipe or hookah. And in the whole sample, almost 40% of them thought that hookah use was less harmful than cigarettes. So how these outcomes were associated with the different covariates I mentioned, we found that in terms of sex, males were at increased odds of use of hookah, which is not surprising. Males tend to smoke a lot more of all different kinds of tobacco products that are out there. Grades, the older grades were at increased odds of ever use and perceiving that hookah was less harmful. So in other words, students were more likely than grade 9 students to think that hookah use was less harmful than cigarettes, and others were more likely, surprisingly, to say that they had ever used hookah. There's no difference, though, by grade in terms of current use. So grade 9 students were just as likely as grade 12 students to say that they used it in the last 30 days. Ethnicity, kids who reported that their sort of predominant ethnicity was or race either Black, Latin, or other increased odds of ever and current use compared to people who reported being white, and no difference between white and Asian or Aboriginal kids. There's also no ethnic differences in belief. So across the sort of cultural span, there were terms of kids who perceived that hookah use was less harmful. In terms of smoking status, current smokers had 8 times higher odds of current and ever hookah use, and 1.5 times higher odds of believing that hookah is less harmful than cigarettes. So this is also not really surprising, given that kids who smoke are more likely to try other drugs, marijuana, alcohol, etc. They're also likely to have tried hookah. And then spending money, kids with more money higher odds of use and belief that hookah was less harmful than kids with reported having no spending money to spend on themselves during the week. In terms of weekly spending money and adjusted odds of current hookah use, we see here, this is the how much money kids report getting every week from jobs or from their parents or other sources. And we find that relative to kids with no money every week, you can see there's a gradient here of the kids who report having a lot of money, much likely to use hookah than kids having no money. And so part of the reason, and we didn't ask this, we didn't ask where people smoke hookah, but I'm fairly convinced that not all kids who smoke hookah do it in their basements, because not all of them have, or in their garages, given that they don't have water pipes. So part of the reason that might explain this phenomenon is that in the hookah bars, you pay and you go and you maybe eat something as well, or you drink something, and then you smoke it. So it's actually a social event for youth, and go and they spend money to do this. And so that sort of makes sense. Perceptions of harm. Even after we controlled for smoking status in the analyses, misperceptions around harm, so kids who perceived that hookah smoking was not as harmful as cigarette smoking, had increased odds of use. So like they were almost 3 times as likely to if they thought it was less harmful. So at the time we looked at the difference between 2010-2011 round of the youth smoking survey and the 2012-2013 round, and found that there were, in fact, significantly higher odds of currently using hookah. And it's actually been changing the time before that, which was the 2008-2009. So it's steadily increasing over time. Is that from research is that hookah use is a growing trend among Canadian youth, and certainly, especially given the current policy context in the many different provinces, including Ontario, about half of the kids who are using hookah are using flavored varieties of hookah. Or implications of this to me are that one thing is that there needs to be greater education around harms associated with hookah use. So that, like I said, one of the main reasons that people use hookah more than they pick smoking is because they perceive it's less harmful, in part because the smoke is as harsh as cigarette smoke, and because of the flavored, the sort of novel taste and the aspect of it. So one of the implications of this research is that people be a little more heavily educated around harms associated with hookah use. And the second thing, of course, is stronger regulation. And so what's happening currently around regulation, there's a small but growing number of municipalities that prohibit hookah smoking in public places, including workplaces like hookah lounges, or sort of Middle Eastern cafes often have hookah because it's a traditional to smoke. And there were, at the time that I wrote this, 2 provinces that prohibit hookah smoking in public, but there were, and that actually has changed. So in the last few months, actually, Brunswick now, Nova Scotia, and PEI all have leading-edge provincial policies of hookah smoking. So now they hookah smoking in all public places, including workplaces, and they also include several municipalities previously, and also also in Quebec, had prohibited hookah smoking, but only with tobacco, and not if it was the herbal kind of shisha. The problem with that, of course, is that a lot is very difficult to tell whether or not there is, in fact, tobacco in shisha, because they often come in big sort of bulk containers, and you can't necessarily test every container. And they'll quality problems with smoking, even if it's not tobacco, even if it's herbal. Actually, now I should update this. There's 4 provinces that prohibit hookah smoking in public. 3 have excellent legislation, and then in Quebec they're not considered leading edge, so some of the hookah bars are exempted. I was just this morning looking at Non-Smokers Rights Association website. You may be familiar with it already. The policy, the legislation around what kind of different policies there are. And so if you're interested in whether your municipality has legislation around hookah smoking in public, that would be helpful to you. And here's just very, very recently, Toronto City Council, many of you may already know this, they banned hookah smoking. And that was to do with the water obviously, but the shisha, even herbal shisha now is no longer allowed. And just a couple of months ago, and then following that, Ottawa also was looking to follow Toronto's hookah ban. And I'm not entirely sure whether this has gone through or not, but it seems like people were fairly supportive at the time. I think there's a lot of action at the municipal level around hookah smoking, because currently in Ontario, like I said, you're not allowed to smoke tobacco, but still many municipalities allow hookah smoking, but you never really know if it's all herbal and it's all bad for health. So, so that is, it's a picture. I just took it from a website. So you can see there's apple cider, blueberry pancakes, Scooby Snack, my favorite, and half-baked, of the different kinds of shisha that are available. There's, dozens, if not hundreds of different flavors of shisha you can buy. And so some of the Ontario flavored tobacco ban, and many provinces are also doing tobacco bans. Current federal legislation does not prohibit flavors in water, like in shisha, only in certain types of tobacco products. So that's one of the ways that flavored tobacco sort of falls through the cracks in legislation is, again, because cigarettes are more easy to regulate because they've been regulated for a lot longer. They're easy to legally define, whereas some of these newer and alternative forms of tobacco are not as easy to define and haven't been legislated yet. And so we're waiting for the legislation to catch up there. So I think hopefully that some of the flavored tobacco bans that are coming, that are actually applicable to all kinds of tobacco, will help also to reduce the increasing popularity of hookah use among Canadian youth. Now turn it over to Bruce.
Thanks so much, Leah. So I'm going to be turning from hookah use to tobacco amongst young adults. And I'm going to be giving you a brief description of this informed smartphone app that our team developed, and they're listed here on this opening slide. We're researching this over the last couple of years. I have no conflicts of interest to declare, other than our research has been funded by Health Canada through the Federal Control Strategy, and we have a CIHR grant for this research as well. So why an app for smoking cessation? Our artist, as I said earlier, came around in about 2011 with regard to this. And we know that the largest percentage of smoking in Canada is amongst young adults. It hovers around 22% based upon the Canadian Youth Monitoring Survey from 2012. We also know from looking at sources such as the Canadian Wireless Telecommunications Association, 72% of young people own smartphones. There's a lot of apps on the market, but most are not based on evidence as to what can help people quit smoking. So back in January of 2012, we started doing some research on how to develop Crave and make something that is much more evidence-based to help people quit smoking. new area of research for us in terms of social media and mHealth, but we think it's a great platform for assessing reach into communities. And from a population health perspective, impact happens when large numbers of individuals can be reached with effective interventions. The potential of something like this is quite powerful if, in fact, we can get something that works in the hands of a lot of people. So the objectives for this afternoon are, I'm going to be describing the development of Crush the Crave to you, the implementation research that we did, and I'm going to be sharing with you some preliminary findings from our randomized controlled trial that we're just wrapping up. So you'll be the first group to see early findings. When we went about creating Crush the Crave, we had two key objectives, and they're listed here. To develop an evidence-informed quit smoking smartphone app and to test its usability, design, and functionality. And our population, when we went about doing this development, was young adult smokers 19 to 29 years of age, both English and French. We had targeted English and French smokers in Canada to help design the app. Methods that we employed listed here on this slide. We first of all conducted a comparative analysis of existing apps to determine what were the most common features and what was missing in terms of evidence-based guidelines. We chose to use the U.S. Preventive Clinical Practice Guidelines to help establish what has been proven to work in helping people quit smoking. We have conducted a number of brainstorming exercises with leaders in terms of working with young adults in quitting smoking, including the folks that leave the pack behind. And we conducted our one round of focus groups, which we called the Content Development Focus Groups. And that happened in Kitchener-Waterloo, and there were two groups there, one of males and two groups of females. And here we sought ideas from young adults for the app and to test evidence-based concepts with them in terms of features, what could work, what couldn't work. We also brought together a team of experts, well, 5 experts, such as Peter Selby from CAMH, Emma McDonald, another psychologist, to help us design components of the app as well. Was done. We had a dummy version of the app, and we conducted what we call our technical development focus groups. Here we had 8 groups in total, 4 in French and 4 in English, and tested the app itself using smartphones that we disseminated amongst them. They pointed out what worked and what didn't, and they offered suggestions for improvement. We analyzed the transcripts from those sessions using inductive thematic analysis, and that was done independently by 2 of the investigators on our team. We also did some beta testing of the app once we incorporated the suggested changes that needed to be done using a Think Aloud protocol, where we had people actually videotape themselves using the app, and they were speaking aloud as they were navigating through the app, just to check that, in fact, what we thought was working. Some of the results that we attained from that phase, the development. Here we have some results from the comparative analysis as well as from the expert panel. From the comparative analysis, we had assessed that Crush the Crave met 20 of the 23 U.S. Public Health Services clinical practice guidelines for treating tobacco use. And our expert panel in general felt that the app was very comprehensive and worthwhile, and suggested that the app include info about community services and to people trying to quit, as well as things like push notifications to keep people to take action, etc. I'm only sharing with you, for the sake of time, what we learned from our technical development focus groups. And here results summarized by thematic heading. There were 2 broad thematic categories that emerged from a review of our transcripts for design and functionality. There was a 3rd category that we labeled additional insights. In terms of design, participants found the app easy to use and navigate, and 2 sub-things emerged concerning the importance of tailoring, with quotes such as, the more options you can give the person who's trying to quit, the better. Whether they want to quit by themselves or quit today or quit 2 weeks from now or even a year from now, they have that choice. And all coming from a credible source. Comments such as, I think that if I was trying to quit or being connected to a credible organization would probably make that one stand out a little bit more than coming from a credible organization. Some of the typical results we had from those focus groups. And in terms of functionality, also viewed favorably. in terms of letters, inspirational messages, distractions that were offered to deal with cravings, backing of the smoking and the craving, awards, etc. In terms of the thematic heading of social support, for example, they would say things like, I like that idea. I'm not one to have everything on Facebook, but if it was something that I was proud of myself for, which would be quitting smoking, yeah, I'd like everyone to acknowledge that. And like distractions, it goes directly to the games I have on my phone. I can go to Facebook or Twitter. When I'm on Facebook or Twitter, you think about something else. I think it's a super good idea. Some functionality. And then finally, that were gathered from the focus group participants. And he had headings like triggers. People don't understand why they smoke and in what situations. And in the other screen, it tells you how you feel, and perhaps you don't need to hang out with friends, etc. So the capacity of the app to actually track and craving behavior. We got feedback on some of the community services that we're offering in the app, such as connecting to a quit line. Feedback, I think that the quit line button is a waste of space or anything. I don't know too many people who would call that number and be like, hey, so I need some advice. I call Mom, I would never call these. Those kinds of comments were constant. We were kind of struck by the fact that young people weren't really motivated to make use of existing community-based services such as quit lines, and also concerns about personal information. I personally wouldn't use the app if I thought somebody was using the information in it. So cognizant of that. This graphic, although it's a little complex, it summarizes all of the work that went into the app, and it's based upon persistent technology theory. It's developed by Bill Fogg from Southern California. There's a set of design principles that they've worked on that's built upon multiple theories and studies, and shown that adherence to an intervention, we want that to happen. 55% of the variance in adherence is explained by persuasive technology design principles. So we felt it important to try and ensure that we covered up as much as we could. And so the diagram is depicting how we've adapted those principles to Crush the Crave. So in addition to being a credible resource, which is identified by Bill Fogg and his team as being important, Crush the Crave is offering dialogue support with such things as messaging tailored to the user and push notifications, task support with things as a customized quit plan and provision of feedback on progress attaining your goals, featuring in awards, and social support, which is the social networks like the Crush the Crave Facebook community, which is built right into the app, as well as to share successes with your own network of friends. Just give you some examples of some of the screenshots that are within Crush the Crave. You can't fit everything into one slide. This is some idea of how the app actually looks. So in terms of tailoring, young adults are also able to choose information that can go right on the front screen, as well as photos that are personal for them. Of course, based upon the input characteristics that you give it in terms of your sex, etc., and your level of tobacco use, it will tailor messages to you based on that. The young adults were also heavily involved into giving advice on its design, and they actually chose a name for the app in those focus group sessions that I talked about earlier. So we had a lot of young adult input into how this thing should look and work. What Crush the Crave deals with, which other apps have not, is the whole no cravings. And based upon research that we've been looking at over the last more than a decade, dealing with cravings is key, since it's a major contribution to quit attempt failure. There's nothing wrong with having as many quit attempts as possible, but successful quit, to manage cravings and deal with that is crucial. So the day Crush the Crave came up, and our emphasis on that. I'm going to be turning now to the randomized controlled trial. After we had piloted the app with about 300 young adults, we applied to CHR, and we received peer-reviewed funding in 2013 to conduct a real-world randomized controlled trial. And in the trial, the intervention arm is Crush the Crave, and the control condition is a paper-based self-help guide that's been developed by Health Canada for young adults, known as On the Road to Quitting. The primary aim of our study is to reduce smoking prevalence as measured by self-reported 7 and 30-day point prevalence abstinence, and that's defined as not having smoked a cigarette, even a puff, in the last 30 days. It's being measured at 6 months after starting the trial. Secondary aims include examining other outcome measures of cessation behavior, such as nicotine withdrawal and craving, and the number of quit attempts and reduction in cigarettes. We're also looking at satisfaction and patterns of use app, including the extent to which it promotes use of established cessation services such as nicotine replacement therapy, and potentially even consulting your own doctor or other clinical service. This has been published, so if people are interested in looking at the protocol, you can find it in the Journal of Medical Internet Research. So we approach to doing recruitment. We had both Google and Facebook ads running, the online classified ads, and we reached out to partners to recruit adults to be part of our study. Ads included calls to action and incentives for participation. If a young adult is to be part of the study, they could receive up to $35 for completing all 3 phases of the research, and they're entered into a draw to win an iPad Air. The Air contains demographic questions and questions related to the aims of the study. A number of psychosocial questions are asked, including confidence and quit, perceived stress, and social support. Ask about use of NRT and other cessation aids. All of the instruments were piloted with a convenient sample of young adult smokers. We had 2 follow-up questionnaires, a 3-month short questionnaire, which just asked questions on smoking behavior and nicotine withdrawal, and then the 6-month survey covered the questions from baseline, as well as asking questions about the smoking status, as well as levels of support received from friends and family for quitting, and of course questions dealing with app usage or use of the condition. We used a modified Dillon protocol to reach out to individuals to try and get the highest response rate we could. There were 10 attempts to reach participants, and the last couple of attempts involved trying to phone them and email people to fill out the survey. Built into our protocol are also what we're calling process or implementation measures. A lot of tracking metrics that are derived from the app, including user logins into the app, number of clicks on different elements of the app, number of rewards, and we also have Google Analytics built into the app as well to look at the numbers of page views and average time spent on a page. Just sense that people are actually using the app as envisioned. We're also conducting interviews with volunteer participants to get a much more in-depth understanding of the barriers and facilitators to use of the smartphone intervention. So this is just an example of the kind of implementation tracking that we're doing. This particular graph is just logging all of the user logins and new accounts created by day through the period of August until November 2014. So blue is user logins, and the dark blue is accounts created. So as our trial was progressing, we were getting more and more activity as people came on board for the trial. Basic data on where it stands. This is of November 27, 2015. We have over 4,000 users, active users of the app, available both on the Android platform and the iPhone. And here's an age breakdown in terms of who's using. The majority of the users are our target population for the trial, but we have people over 50 who are also using the app. And there's a gender breakdown. More females than males who are making use of the app. Just looking. This is a flow diagram that's showing the response rates, what's finally ended up being our overall response. We have over 3,000, almost 4,000 individuals start the survey. You go through a series of eligibility criteria in order to be part of our study, and that included, of course, being a daily smoker, that you had to be wanting to quit in the next 30 days. You have to have a smartphone. You couldn't refer to the study by a friend who may already be in the trial to avoid cross-contamination, and of course had to fit the age group. And so that we ended up with 1,900 eligible consented individuals. And to get to the intake survey, we had 1,600 who completed. So it's about 84% of those who consented, or 42 or 40% of those who started the whole process. And that works down to the 6-month follow-up, where we had almost 55% of those who take having completed the follow-up survey. Turning to our results, all those who are in our study, the average is about 24. We have 53% male, 46% female in the study. 46% have high school or less. 48.5 or less than 30K in terms of income. City is majority white. Majority of participants are coming from Ontario. We only have 5% coming from Quebec. Unfortunately, even though the app is in both official languages, our surveys were only available in English. So we didn't recruit as many individuals from Quebec as we would have liked. People are definitely addicted to smoking. The average number of cigarettes smoked per day was about 13, and 20% have their first cigarette of the day under 30 minutes of waking up. So people who are very much addicted to nicotine. Another finding I wanted to share with you, and again, this is all very preliminary before I get to our final results. So we asked about the various cessation resources that people had used at AIC, including e-cigarettes or vaporizers. And what we find is, again, a very low percentage using quit lines, almost 50% who have tried some form of nicotine replacement therapy. But the surprise for us was the percentage of young people who were using e-cigs or vaporizers. So it was 50%. Population had tried e-cigs or were currently using e-cigs as a cessation resource. So we're going to be exploring what impact that might have on helping young people quit smoking or not. That'll be happening in the coming months. So in terms of the trial, and again, your first groups who have seen these findings, we have yet to finish our analysis. What we're showing here in terms of our primary outcomes, 38-point prevalence abstinence, is for the self-help guide, almost 28% had quit smoking, and for the smartphone app, it's about 25%. There's no significant difference in those amounts. And for the 7-day being rate, it was 40% in the self-help guide and about 36% in the smartphone app condition. We have some secondary outcomes that are basically the same, except for the numbers of cigarettes per day, being at 6 months, which was higher in the Crush the Crave group and in self-help guide. So what we're seeing here is that the self guide is just as good as the smartphone app, which is a self-help intervention in terms of helping young adults quit smoking. We don't see any significant differences between those two groups. Research, which I introduced earlier, is very excited about what we've done. It's one of only 3 studies that we're aware of to assess the effect of a smartphone app on smoking cessation, and to our knowledge is the first large sample size study of young adults. This is what we've seen to date tend to be very small, not as large as this one. And so, as I was saying earlier, we see that a well-developed app has the same effectiveness as a well-developed paper-based guide for young adults, such as On the Road. We think there are going to be improvements that are possible. We've learned a lot through the research to date, and we've about taking what we've learned and making even something better. It has an important implementation research component, and that's going to give us a lot of insights into why this app has worked and how for whom, etc. The research has a lot of potential for informing decision-making by health practitioners and policymakers into adoption of mHealth for smoking cessation. And things will be critical as more and more decision-makers are being pushed toward adopting and scaling up solutions. And we've learned in discussions with the health and others that often this is done with a lot of evidence. There's just a push mostly from the private sector to a lot of mHealth type interventions without a lot of evidence to support it. And so that's the conclusion. I just want to acknowledge a lot of the contributors to our research, more importantly, Leave the Pack Behind for a lot of their expertise and the ongoing contributions that they provided in helping to create Crush the Crave. And of course, thank all the team at Propel and the rest of the investigators, and of course our funders, Health Canada and the Federal Tobacco Control Strategy.
Leah and Bruce, for this excellent presentation. We're now going to take some time for questions. So just a reminder that if you do have any questions for Leah or Bruce, that you can type them into the chat box. And we'll try to get through all of them in the next 15 or so minutes. One question that's come through: are there any concerns in regards to referring youth under 18 to this app?
In terms of our protocol, we went through ethics review, and we decided that we had to stick to a range of 19 to 29 in terms of rules around age of majority and informed consent in Ontario. Given that this is available through Google Play and the Apple's iTunes store, there's nothing preventing people under 18 from downloading the app. That is something that we don't have control over. So to speak to that point, based upon the review that we had in our ethics approval, we only recruited people at 19 and between 19 and 29.
Great. And then just another comment that's come through in regards to Crush the Crave is a comment that says, Crush the Crave app is something I will start referring my younger clients to, as often follow-up in the clinic can be a concern. This to engage younger clients in the way that they want to be engaged.
Great.
Another question that came through, is any research to show that something like nicotine replacement therapy helps those individuals using hookah to quit smoking?
Bruce, take that lead. The hookah use, if it's tobacco, has nicotine in it, obviously, but it would be no different, I don't think, than like nicotine replacement for cigarettes. Depends how frequently. I mean, some people, not me, but other people have done studies looking at toxicology of and nicotine that gets into your bloodstream from hookah versus cigarettes and that kind of thing. Basically, the majority of studies find that it depends on the user and how deeply they inhale and how long they're in this sort of social setting. But just like with smokers and cigarette smokers, you'd have people who are more or less nicotine addicted. So maybe, but in terms of the cessation, I'll let Bruce take that.
Yes, I have to say that we have a lot of evidence on the effectiveness of nicotine replacement therapy, particularly that combined with cessation counseling. That tends to be the most effective intervention of everything that we've been able to put together. The one thing that I'd want to point out with regards to hookah use and other tobacco forms, and including something like e-cigarettes that have nicotine in them, is research is starting to show amongst young people that those alternatives are not generally as effective in helping them quit smoking as something like NRT. I can put the evidence that we've gathered on this study, although it's still under development, but looking at data yet last week, we looked at those who are making use of e-cigs as part of our study versus those who are not, and their quitting success. And we saw that only 8% of the people using e-cigs in our study had smoking at 6 months, as compared to 22% of those who were not using e-cigs. So what thing is that a lot of e-cigs are available in Canada with nicotine, despite the fact that Health Canada has said that they shouldn't be distributed that way. No one regulating it or taking any action to stop it. So young people are using e-cigs as a way of maintaining their addiction, based upon the data that we've got. I think that would apply to hookah as well. In terms of a cessation strategy, it doesn't work, and I just want to support all the work that's been done to date with regards to the use of NRT and the counseling that's being done in practice and other settings.
Great. Another question that's come through, are there any infectious disease concerns with social use of hookah?
Yes, definitely. So, and I'm not a clinician, so I don't deal with infectious diseases, but I think it's Hep C.
Yeah.
See, I think is the major concern, right? And so I was reading recently, and I can't remember where, so this is not helpful because it would be more helpful probably to go Google it, but that's one of the reasons as well that's often cited in not just indoor air quality, but one of the reasons that people frequently cite in terms of why hookah bans are a good idea in public places. Because the risk of transmitting infectious diseases on the mouthpiece.
Another question, in regards to flavored shisha, my understanding is that smoking flavored shisha carries as many health risks as tobacco-based shisha. Can you comment on this?
So there's a distinction. I don't think it can be either herbal or tobacco. So I don't know that the flavor is not what necessarily distinguishes them. It's the herbal versus tobacco. So I think, obviously, anytime you add a chemical flavorant and you burn it up, it's to create its own sort of combustible materials. So flavored anything would be worse than non-flavored something. But in terms of, and there's been research out of Montreal and research out of Edmonton looking at the toxicology of specifically herbal use. So that's non-tobacco shisha that's being smoked, whether it's flavored or not, and that still produces, carbon monoxide, heavy metals, and other things that are cancer-causing agents into the atmosphere and into the lungs of the smokers, even if it's not tobacco. So there's been some movement and some conversation around, given the perception that people think when you think herbal or natural, they're healthy, then something like herbal, how can we call it herbal shisha or natural herbal shisha, those kinds of things. There's been some movement or conversations around how people are able to describe and sell shisha. Because again, the perception of herbal supplements or herbal, would be is that they're healthier, and that's just not the case. So I think the concern is even if herbal is not as harmful because it maybe doesn't have the nicotine, it has a lot of the other chemicals that are cancer-causing agents that are present in tobacco smoke.
Another question, can you comment on what some of those harmful effects of hookah use might be to health?
So, similar to the associated with smoking, cancer is a big one. I'm really sorry, I'm not a clinician, but I'm happy to maybe send a link to a paper or get papers that actually describe specifically which cause which diseases and which compounds are present in hookah or in shisha, or working a water pipe or hookah. So I can do that as a follow-up, but certainly, carbon monoxide is there. And like I said, some of the heavy metals are in there. So I'd say harmful effects are similar to smoking in terms of the long-term consequences.
I know from reading and attending other webinars on different topics, it's really often down to that point of anytime you're combusting anything and then inhaling it, the products of combustion themselves can be quite harmful to the lungs, of course. Whether that might be smoking marijuana or hookah use, those sorts of things. It's just anytime that you're combusting a product and inhaling it, those effects to the lungs are not great, sort of thing. So thank you.
I think one of the other things I'll just quickly comment when you said marijuana there, things I've been thinking about, because we for the CSTADS project or the YSS, the Youth Smoking Survey, it's a biannual survey, so it happens every 2 years, and at the time that they implement the survey across Canada, they do focus testing with youth to make sure, the questions are clear, they're understanding things, that's the language that they use. For example, if they're not saying e-cigs anymore, maybe they're saying vape pens, and how do we make sure we're answering or asking the questions as accurately as possible? And so one of the last year, I think, or the year before, I did, can you still? Okay.
Yes.
My computer screen just went black, so I just wanted to make sure. But when I was doing focus groups with youth, one of the things they mentioned was that they use water pipes, but they don't use it to smoke tobacco, wink, wink, nudge, nudge. And that was really interesting. And one of the things that I think, because I was a little surprised actually that flavored hookah use was, or flavored tobacco in hookah was only half. Because when you have the choice between, you know, or apple cider or any, like chocolate or any other flavor, why would you choose regular, just flavored? But I think, and we have this question, so I can't empirically investigate this, but I wonder if it's because kids are using hookah to smoke marijuana or mixed with tobacco or those kinds of things. So I think hopefully in future surveys we can also look at all different kinds of things kids are smoking in water pipes, not just tobacco, even though obviously tobacco is very, very important.
Great point. In your opinion, just looking at the fact that flavored tobacco bans have been enacted, and you mentioned that shisha was not included in this, do you think that shisha will be something that will soon be coming down the pipeline in terms of regulating for shisha?
So in the federal legislation, I think it will, but only that's because I think the provinces have stepped up so quickly and powerfully against flavored tobacco. So I think Ontario, they do cover all tobacco products, not just cigarettes and cigarillos and cigars. I think everything, but certainly the provincial policies do vary. So, for example, when Alberta first announced their policy on flavored tobacco, and they were the first province to do so, they had federal legislation. We're going to ban all of these, you know, strawberry shortcake, and we're going to ban bubble gum, and we're going to ban, you know, grapes gone wild, but we're not going to ban menthol because menthol's been around since the 1920s. Even though there's tobacco industry documentation saying that they absolutely target menthol kids. So after that, then Alberta ended up banning menthol as well. So there's federally menthol is exempted from flavored tobacco legislation. But the recent federal change in legislation was before it was when Stephen Harper, I think it was in 2008, when he did it was flavored tobacco. We're gonna ban kitty flavors from tobacco, but that's over 1.4 grams. Little cigar, a cigarillo that's 1.5 grams. You can still have it as long as it's more than 1.4 grams. The flavors and flavor. So obviously, the tobacco industry, being the smart industry that it is, chose 1.5 grams rather than 1.4 grams or 1.3 grams. And so, I mean, my argument to that was, I don't need teenagers who can tell the difference between 1.4 and 1.5 grams. So the recent federal amendments to that legislation said that it has to be 6 grams, and they can still flavor it, but it has to be 6 grams or more. All still exempted, and it still doesn't cover things like hookah, or other kinds of like alternative tobacco forms. So, but that's where I think the provinces, including like Nova Scotia, Alberta, PEI, New Brunswick, Ontario, have all begun to step up quickly, like I said, and quite powerfully to close those loopholes, to say no flavors, anytime, in anything tobacco related. So I know if the federal government will see a need for that legislation if the provinces all do it.
Exactly. Sounds like that's the way we're going, is provinces stepping up and sort of covering those loopholes. Okay, question for Bruce. Do you mind repeating the quit rate for those using e-cigarettes versus the other means mentioned?
Again, cautionary note, and this is still preliminary, but we're pretty confident that these are the numbers based on this week's analysis. And the population that we recruited, these are people who are addicted to tobacco between 19 and 29 years of age, and they have intents on trying to quit smoking. And when we asked them about use of e-cigs, we found that 8% of those using e-cigs had indicated they had quit smoking at 6 months. To the people who said they hadn't used e-cigs, when they reported a quit rate of 22%.
Thank you.
Again, the point here is that even though e-cigs aren't combustible tobacco, it would appear that those who are using the e-cigs are probably using them in circumstances where they can use e-cig, but they can't smoke, and then get the opportunity to go back to using their cigarettes, maybe back at their home or somewhere else. To explore more as to what's going on with that population, and it's one of the questions we'll be posing when we're doing our voluntary interviews with folks who've agreed to be interviewed. It's one of the things that's prompted us.
Great. And looks like the last question I have, again, if you have one or two more questions, please feel free to type them into the chat box now. The last one that I have, though, is just in regard to the cultural component of hookah use. Do you know of any research or documents that sort of talk about how to address hookah use and sort of being sensitive around the cultural aspect of hookah use?
That's a great question, and I know it's been something that has been in the media frequently about, well, if you do this, then you're attacking cultural activities, et cetera, et cetera. What I find really interesting is that several Middle Eastern countries where this is a cultural activity, like, and I mean Syria is not a great example because other problems in Syria right now, but Lebanon, Jordan, parts of Turkey, parts of India, they have all banned hookah use indoors as well. Recognize that it's a health issue, which is more important than the cultural activity. So, this argument does hold water in terms of, well, we shouldn't do it in Canadian municipalities because we might be infringing on cultural activities, but those countries where it is actually a predominant cultural activity are banning it, then why shouldn't we?
Mm-hmm.
In terms of, if thinking about like sort of counseling, someone might be from Lebanon who it is a cultural tradition. I don't know of any resources that would be, so I don't know of any resources that would be useful in terms of like a one-on-one kind of counseling, smoker hookah use cessation kind of approach. But it is helpful to know that even in those places, it's not just, it's not Canada saying, hey, we don't welcome with other cultures. It's Canada saying, we like you. We're not saying people can't do it. We're saying that it's not okay to expose workers, people who may not be choosing to smoke hookah, to harmful when they're to, enjoy their meals or whatever. So, a specific resource, though.
So just to note that these steps have been taken in countries where traditionally hookah has been used, that health is certainly a priority. Great. So I think that's it in terms of questions. So I will just end today by thanking once again Leah and Bruce for excellent webinar for us today, and thank you for everyone who has joined in and participated in this webinar and the discussion. Just to let all the webinar participants know that you will receive an email from RNAO within the next 24 hours, and it's going to link you to a short evaluation survey for the webinar, and then once you've completed the survey, you'll be able to print off your certificate of completion. So we do hope that you will continue to join us for upcoming webinars, and we ask that you do check our website, tobaccofreerno.ca, on an ongoing basis for a list of upcoming webinars and events. So thanks again, Leah and Bruce, and to everyone who participated today.
Thanks very much.